Hello, thank you very much for this lovely introduction. I'm very pleased to be nearby you in Beirut. It's not so far, so I can spend every weekend in your country, this beautiful country. I feel very comfortable here. We share the same institutional background, as you see. I am in a university hospital called St. George Hospital, which is a very famous saint in Cyprus also. Uh, this talk will be very challenging, as you know. I will start by giving an overview of what we Google on breastfeeding. If we start by Googling on breastfeeding, you will see that there will be more than 100,000 articles on the advantage of breastfeeding. If you Google more, you will have the advantage of breastfeeding of your baby more than 347,000 results. So the importance of breastfeeding in the scientific literature is so huge. If you go further to the advantages of breast milk and advantages of mother milk, you will see that the Google results will highlight 340,000 results. And if you go to the advantage of breastfeeding for mother, you will get almost 50,000 results. There is a huge interest of breastfeeding in the medical literature. Why? Why the rationale behind breast is breastfeeding? Why? If you look to the facts from the literature, we will go through two important facts. The first facts are on infant mortality, and the second fact are on infant morbidity. So let's go through the first facts. What are the facts from the literature on infant mortality? You see here the relative risk of early infant mortality by breastfeeding pattern, and this was highlighted since 1987 by the Victoria study. And you see here, you see here that is the exclusive breastfeeding, the nearly full breastfeeding, the partial breastfeeding, and no breastfeeding at all. And you have here two components of major infant mortality factors: acute respiratory infection and diarrhea, all over the world. This is the Victoria study. And as you see, whenever you use the exclusive breastfeeding, you will decrease the mortality regarding the partial and the none. You will decrease the mortality due to acute respiratory infection, to diarrhea, and to acute respiratory infection. Goes the same for diarrhea. So this is well attested by this first study long time ago, that showing that the use of exclusive or nearly breastfeeding will decrease the mortality due to acute respiratory infection and diarrhea. This is the first one. The second one was highlighted in the last Lancet series 2013, and I wish you to go over this series, which is a very interesting series published in June 2013 on nutrition all over the world. And as you see here, this is the scale-up intervention on deaths on children, showing that promotion of breastfeeding comes at the third rank in decreasing the infant mortality all over the world. The first one is management of acute malnutrition. The second one is preventing zinc supplementation. And the third one is the promotion of breastfeeding. This is a very important, far away from the other appropriate complementary feeding management of acute malnutrition, periconceptional, acid folic, and so. So this is far away the best way to promote, to enhance the under 5 children mortality rate, the decrease of under 5 children mortality rate. Is that clear? So there is a clear outline that breastfeeding decreases infant mortality. Switching now to infant mortality, which is more and more interesting. What I mean by infant morbidity. The infant morbidity is all those listed here. Otitis media, gastrointestinal infection, respiratory infection, atopy, wheezing, obesity, SIDS, necrotizing anticoagulants. Anyway, this is a study published in 2009 by the European Society of Pediatric Gastroenterology showing the effect of breastfeeding on infant morbidity. And those are the results. Some are evidenced, some are possible evidence, some are probable evidence. So there is a big bias in the effect of breastfeeding on infant morbidity. And this is also on high blood pressure, on serum cholesterol, or on intelligence. There is a lot of debate on that issue. But there is certainly a positive effect on infant morbidity. Why? Because of the biological characteristics of the breast milk, protein, lipids, carbohydrates, immune components, the LC-POFAS, probiotics, and etc. So this is a whole story about that, but I will go into details of those infant morbidity to show you how breastfeeding is effective. What about the effect of breastfeeding and on obesity and the metabolic syndrome? What we know from the literature and from the recent growth velocities done by the WHO undertaken between 1997 and 2003, and this is actually the references of growth velocity in the world, WHO. It shows us that the breastfed babies have a slower growth velocities than the formula-fed babies. That's clear. So one, you must take into account that breastfed infants does grow slowly. In the contrary, we do know from the literature that the rapid increase in weight in infancy will lead to increased BMA, would lead to increased obesity. So whenever you have a rapid growth during the first year or second year of life that is provided by formula-fed infants, you will still be fat and obese later in life. Whereas those who grows differently will be thinner, would not get this high obesity rate. So my first conclusion is that the slower growth velocity in breastfed babies prevents occurrence of late obesity. And this is well known. Look at this, published in 1999. This is the months of breastfeeding. If you don't breastfeed your baby, the prevalence of obesity would be 4.5. If you breastfeed him for 6 to 9 months, you'll see that graphs showing the decreasing prevalence of obesity with the breastfeeding duration. Is that clear? So if you are obese now because you wasn't breastfed correctly, including me. And this is another elegant study published in 2005 showing also the duration of breastfeeding in months and the odds ratio showing a decreasing incidence of obesity with increasing duration of breastfeeding. And this is the result of 16 studies. Is that clear? So, clearly, there is a beneficial effect of breastfeeding on infant mortality and now on obesity. And why? Why there is a clear benefit of breastfed milk on obesity? Because of this protein hypothesis that you know very well, and you see that the comparison between the human milk and the infant formula, the human milk has lower protein content compared to infant formula who have a high protein content formula. And you see that the high content protein formula would create an insulin, increase in weight gain, and risk of obesity. So it's a matter of protein content. And the breast milk is the most important way to control obesity. And that's why all actually the formulas companies are tending to lower the protein content, but they will never reach the possibility to achieve what the breast milk will do. Never. So, the early protein adiposity is this. Please cancel this because it will lead to an over obese person. As much as you can, you have to provide lower protein content, and the best way to do it, the best suitable way to do it, is by providing human milk. Is that clear? So, let's move on the effect of breastfeeding and metabolic syndrome. You know what is the metabolic syndrome? It's the occurrence at late adulthood of type 2 diabetes, high pressure, and cholesterol profile increased. So, do we have any studies on breastfeeding and the metabolic syndrome? This is a very elegant study. I don't know if you are aware about those studies. This is a comparison between the outcome of infant and adult who has been breastfed during their early life. This is the ALSPAC study. It's a part of the European ALSPAC studies, very well and prospective study. And this is the PELOTA studies run in Brazil in 1993. And this is published recently in 2013. This is systolic blood pressure, this is diastolic blood pressure, this is body mass index, and this is the IQ. If there is a controversy on the effect of breast milk on the metabolic syndrome, there is no doubt that breast milk will enhance the IQ. And this is very important and well demonstrated studies. So, in the high income country, it seems that breastfeeding has an effect on the metabolic syndrome. But in low income country, due to the environment, the effect is not reached. If you compare the ALSPAC study to the other cohort study in Europe, you will see also that the ALSPAC study would also have a beneficial effect of breastfeeding on metabolic syndrome and also on IQ, but not in the consortium, the cohort studies that are not well randomized. So, if controversies remain on metabolic syndrome, there is no doubt about the causal effect of breastfeeding on cognitive development. And this also was highlighted long time ago by Anderson in 1999. This is a meta-analysis on the effect of breastfeeding on cognitive development, showing an enhancement of 3.16 in the breastfed group. And Anderson also in this study showed that breast milk is associated with cognitive benefits. This benefit is greater in low birth weight infant than normal birth weight infant, and cognitive benefits increased with duration of breastfeeding. Nonetheless, have you heard about the Probit trial? You didn't heard about this fantastic international study conducted in Belarusia over 17 years in a prospective way and published recently in the International Journal of Epidemiology. And this is the Probit, this is the other study, Pelotas against Alspac, showing both of them attesting the effect of breastfeeding on IQ. Let's go a little bit through the Probit trial study on infant morbidity. This Probit trial study showed that there is certainly in this very large group over 20,000 neonates and infants and children were prospectively studied. There is in this study the reduced effect on gastrointestinal tract infection, on atopic eczema, beneficial effect on cognitive development, and what is very important is that there is a benefit on the subsequent child to be breastfed. But there is a lot of controversies on the other component on infant morbidity. But if we go through further other studies, we will show that exclusive breastfeeding has a protective effect on asthma at 8 years. This is a study, the children allergy Stockholm study, showing that whenever you exclusively breastfed for 4 months, you will decrease the rate of wheezing and the rate of asthma at 8 years. So there is a beneficial effect. And the most important study that showed the superiority of breast milk infancy is the Genie study that was conducted in Germany. And the recent results, 10 years over this prospective study, showed an overall interest of breastfeeding in preventing atopy.
We have 5 minutes.
5 minutes? I will finish. So, what are the reasons behind controversies on effect of breastfeed on allergy? It's one, the variation of omega-3 contents in breast milk. Let me show you those 2 elegant studies published recently in 2011, showing that the highest rate of omega-3 in breastfeeding infant was in breastfed infant was associated with a decreased atopic dermatitis at 2 years and a reported also atopic. It goes the same for allergic sensitization and at 2 years. So the highest rank in LC-POVAT in breast milk will allow a better prevention of allergy. And that's why there is discrepancies in those studies. The other factor that goes on the effect, that can vary the effect, is the variation of breast milk, of probiotics in breast milk. And as shown in this elegant, this is the variation shown in the same milk of a mother. Look at the difference in the probiotic strains. So, if there is controversies in the literature, it is maybe due to the content of LC-POVAS and probiotics in the same breast milk of the mother. And this is showing you that whenever you increase the probiotic, you will decrease the allergic diseases. So the reason behind this discrepancy of the effect of breast milk on allergy is mainly due to the variation of LC-POVAS and the variation of probiotics. So you have clear benefit to enrich the mother breastfeeding by LC PUFAs and probiotics. So my last 2 minutes, I think, will be led to the breastfeeding promotion initiative. And if we look actually to the disaster of breastfeeding in the world, we will see that exclusive breastfeeding is only about 30% or less in major UN regions. Even though I have convinced you now that breastfeeding is the best, nonetheless, it will not work because we are not promoting this breastfeeding campaign. And you know that actually, this is the, sorry for this busy, but breastfeeding is one of the major components to achieve a good adult life, a healthy adult life. So if you don't promote breastfeeding at birth, you will not be elegant with your mothers. And this is, for instance, the breastfeeding promotion effect on breastfeeding rates. If the breastfeeding is initiated at 1 day, there is an increase in the duration of breastfeeding. And if breastfeeding is at 4 and 6 weeks, this will increase also the exclusive breastfeeding. And if you don't breastfeed at the first day, it will decrease all over time. So you have to initiate and promote exclusive breastfeeding at birth, and this is the way to do it. So finally, if I have convinced you about the good effect of breastfeeding, I will be pleased to welcome you in Malta next year, 27-29 March, in the Mediterranean Congress of Pediatrics, where you will be also well. Thank you very much for your attention.